Next in Better Health, the Highlanders were at the launch of the Southern District Health Board's flu campaign.
So today's been the launch of our staff influenza vaccination campaign. So that's a campaign aimed at encouraging all staff in the District Health Board to get vaccinated against influenza. It's a campaign we run each year. The aim of the campaign is to get as many staff as possible vaccinated against influenza. And the reason for that is twofold. First of all, to protect them and their family against influenza, and secondly, to protect our patients against being infected with influenza from staff. Vaccinations aimed at the general public will be available subsidised in general practice until the end of July. So if you're a member of the general public and you don't work for the health board, you can have an influenza vaccination at your general practice up until the end of July. If you're a member of the health board staff, you can get a vaccination against influenza at any time from now on, but we'd encourage you to come forward as quickly as possible in order to get protection early on in the influenza season. So in the general population, there are a number of groups who get subsidised influenza. Those are the over 65, so anyone who's over 65 can get a subsidised jab from the general practice. For the under 65s, anyone who's pregnant, all pregnant women are eligible for vaccination at any stage in their pregnancy. It's important that pregnant women get vaccinated because they're at the greatest risk of poor outcomes from contracting flu while they're pregnant, greater than any other group in the population. People with chronic conditions can also get a subsidised vaccination. That's people under 65 with chronic conditions. So that's people with heart or circulatory disease, people with lung disease, people with chronic kidney disease, people with diabetes, or people with any other condition that can affect their immunity. And finally, but importantly, children under 5 who have severe asthma and are on treatment for that can also get a subsidised vaccination. And if there's any confusion or doubt as to whether you're eligible or not, then the best people to ask are your general practice. Well, last year, across New Zealand as a whole, over 1.2 million doses of influenza vaccine were administered to the general population, and that's the highest number ever. In the health board last year, 53% of staff had a vaccination against influenza, and that's the highest in the Southern District Health Board ever. But we want to see it higher than that. We know that in North America, in hospital settings, up to 95% of staff coverage can be attained. I think the 53% figure is important for another reason, though, because it's for the first time the majority of staff in the health board employ have been vaccinated against influenza. So it's now the norm that staff will be vaccinated against influenza. And I want to see more staff coming forward this year, accepting their professional obligations to protect themselves and their patients, in the same way that they use gloves when they're performing procedures to provide protection to themselves and their patients. So influenza should be seen as a protection to their own health and protecting their patients from harm. It's great to have the Highlanders here, partly because they are, like health board staff, they're professional outfits, they work in a team, but they recognise the importance of protecting themselves against influenza, and they recognise that vaccination is a really effective way of doing that. And clearly it enables them to continue to perform at their peak throughout the whole season, and that's what we hope for our health board staff too. It's the busiest time of year. It's important that health board staff are not ill with influenza, that they're available to do the job that they're trained to do and that they enjoy doing.
Well, I just think if it stops one person getting the flu, it stops the flow-on effect with more people getting the flu, and everyone's healthier and feeling better.
I guess I don't want to be sick, like any time during the season. That would mean missing games and stuff. So I think this is really good for us, and, as a team, or even anybody, with work and stuff. So.
Yeah, well, for me it's worked, and I think it's a good thing to get going and to help out the Southern DHB. I think it's a really good initiative.
I would say listen to the experience of the Highlanders and then go along, get it. If you're a health board employee, come along to our clinics. If you're out in the population, then find out from your general practice when you can get the jab, but get your jab.
the reason why I
You can have two, because I can't give the other guy two and not give me two.
I'll get two.